Well, thanks for sticking around with us. From injuries to congenital issues, many spinal conditions worsen over time if left untreated. So recognizing early warning signs is very crucial. Here to talk about some of those signs to look out for and treatment options available to Gulf Coast residents is Dr. Orhan Ilercil, with Memorial Hospital. Thank you so much for being here.
Thank you very much. It's my pleasure.
Awesome. So over time, of course, technology changes and you see different things going on, but you tell me that you've been practicing since '95. What are some things that we should probably look out for now?
Well, generally speaking, as far as symptoms, if you experience neurologic symptoms, numbness, weakness, pain that's not necessarily in your back or in your neck, but traveling down your arm, traveling down your leg, those are signs of involvement of the nervous system.
Yes.
And so those are things to be very critically aware of. And over the last 30 years, things have changed dramatically, and particularly in the last 10 years. You know, most of what we're brain surgeons, but most of what we see is spinal disease. And with technology, the way we treat spinal disease has changed pretty dramatically. We use computers now, and we use minimally invasive techniques, including the microscope. We make small incisions rather than a large incision across the back, so as to...
Does this cut down on surgery time?
I wouldn't say it cuts down on time as much as morbidity. In other words, you're not traumatizing the muscle. You're not injuring things as much. And with the improvements in anesthesia, cutting time is not as important as cutting how much you cut, if you will.
And being accurate for sure.
And being accurate, absolutely. But no, we're doing things in a much more minimally invasive, atraumatic manner if we have to go to surgery. But most of these patients, I can get them better without surgery.
Now, how can you catch them early on? If they're having these symptoms, what are some things that they probably need to look out for?
Well, again, neurologic complaints.
Yeah.
You know, if you're having a headache and it's chronic and you have associated symptoms like vomiting or dizziness, a lot of times people just live with these things and they really need to get checked out.
Yeah.
Any sort of neurologic symptoms are particularly of worry.
And it can worsen over time. That's probably basically like with everything else.
That's the thing with spinal cord involvement and nerve root involvement. If you wait too long, the procedures we do, we don't put the nerves back together, we free up the nerves. If the nerves have been damaged for so long from so much compression, well, then we don't get as good a result. So
and I know most people don't like to hear the worst case scenario, but what could happen if you avoid these symptoms that you've been having for quite some time?
Well, you could lose function. You could have paralysis.
Yeah.
It's a very dangerous situation.
All right. Well, thank you so much, Doctor, for all of your time. If you could just let us know what are some things that people probably need to be doing at home before we go.
Well, obviously be very, very careful when you're getting on ladders in the holidays.
Yeah, putting up lights and everything.
Putting up lights, all of those things. Careful when you're driving, be very attentive, and just try to avoid these problems if you can. And when you do notice these symptoms, to reach out to your primary care physician and be very vocal and be your own advocate. Take charge of your health care and seek out help.
All right, Doctor, thank you so much for your time. We truly appreciate you.
It's my pleasure. Thank you for your time.
No problem.
Bye-bye.